Well, mental health is a topic of conversation that's happening in households across the Mississippi, really across the state. We've got Stephanie DeSherry with us, who's the CEO of Neurospa. How are you?
Good. How are you?
I'm well. Thanks for joining us. So when it comes to mental health, a very common treatment that most people don't know about is TMS. Tell us a little bit about that.
Yeah, TMS is transcranial magnetic stimulation. It was FDA approved actually in 2008, so it's been around a lot longer than people think that it has. It's totally outpatient, it's FDA approved, and covered by most payers in our region also.
So if you were going to suggest TMS to someone, why would be the reason that you would prescribe that or suggest that?
So typically TMS is approved for patients that are 15 and older. It used to be 18 and older, but recently it was FDA approved for adolescents as well. Anyone who's treatment resistant. So treatment resistant depression used to be more complicated than it is now. Now it's typically considered after 2 medication failures.
Okay, so if someone, what would be some symptoms that someone would exhibit that would lead them to think? Because again, I think part of medicine is more reactive than proactive. So how would someone begin to understand that there might be a challenge they're having that they need to speak to a doctor about?
Oftentimes our loved ones notice it too, so we really need to listen to our loved ones if they are worried about us or concerned about our symptoms. Some warning signs or symptoms you can look out for in yourself are just feeling sad more than half of the time, crying spells, self-isolating, and some symptoms that don't look like depression are actually symptoms of depression, like irritability and anxiety, difficulty concentrating. A lot of these symptoms can come from depression.
Well, some of those symptoms that I feel like you've been reading my history, my patient history. So some of those symptoms could be precursors to other things as well. Is this something that, like irritability, is that something that is like more often than not? Is that when you would, maybe be, or you had a couple of other symptoms that you mentioned. Are those things that we would be seeing, like I said, more frequently than not? And that's when we need to, because I guess everybody has a bad day.
So for the sad mood or depressive symptoms, those would definitely be more often than not. But really, one of our psychiatric providers assesses each patient and lets them know, if they meet criteria for that diagnosis, and if the treatment is appropriate for them.
Yeah, and oftentimes people just think, I'm just having a bad day. Yeah. And they pass it off. But then a bad day turns into a bad week, turns into a bad month, and maybe they're not noticing it. I'm glad you mentioned that family members and loved ones would see that first, because you may not know what's happening to you. It becomes normal. Yeah. And then it doesn't seem as much of an issue until those loved ones begin to notice it.
That's a really good point, because a lot of people, especially adults with depression or adults who are having issues with mood, we tend to ignore our own issues or try to brush them aside because we have so many other priorities and so many other people to take care of, or family members that we feel may have it worse off. So we tend to minimize our own symptoms, I think.
And that really just makes matters worse for everyone.
Yes.
Because then those folks that you're caring for, a lot of times I think of caregivers or parents, you're in the process of caring for other people in the household, and unbeknownst to yourself, you are making the situation worse for everyone in the house or everyone in your area, in your bubble.
Yeah, sometimes seeking treatment or even being assessed for treatment can inspire even your friends or loved ones to look at their own symptoms and consider it for themselves too. A lot of us are struggling in the dark and not talking about it. So I think it always helps to be open about what you're pursuing treatment-wise too.
It reminds me, I had a teacher who once said, it's not best to suffer in silence, because you help no one. You're not helping yourself, you're not helping those around you. So if you feel that there's something even just a little off, it's better to ask a question and be said, yep, you're just having a bad day, or to get ahead of something that you could prevent, more issues down the line. That's
a great point. There's a lot of evidence that treating depression early on leads to better outcomes than if you wait until symptoms are more severe or more concerning. So, and that really goes with any illness or condition. The earlier you can intervene and get treatment, the better your outcome is long term. That's not to say severe depression doesn't have good outcomes, but it is important to try to notice signs of of changes in your mood and check in with yourself regularly.
Now, is this something you would need a referral for, or can you just schedule an appointment at Gulf Coast Neurospa and then come in be seen?
So at Gulf Coast Neurospa, we try to make it as easy as possible for everyone. We don't require referrals, but we do accept them. Patients can call and schedule. They just can't call and schedule for someone else without consent or a release. But no, we don't necessarily require them. We want to make the pathway to treatment as accessible and easy as possible.
So the TMS, should we go over and check it out?
Absolutely. Let's go. I'm going to take 3 measurements, and then our software actually calculates kind of an X and a Y axis that we use to label your dorsolateral prefrontal cortex. Your motor threshold is 35. That's the strength or Teslas of the machine. And then the treatment is administered between 80 and 120% of your motor threshold. So we start the treatment much lower so that you can barely feel it. And then we just increase as tolerated. So one of our technicians will place the coil over the treatment center that we labeled and start the treatment at the strength our psychiatrist just measured. There we go, so it's locked in. Did you feel the increase?
Slightly.
Is it uncomfortable?
Nope.
Okay.
It just feels like a little tap.
Sometimes we do back it off a little bit, like I said, just based on the specific patient and their comfort level. This stimulation goes for about 19.5 minutes in total. It's 3,000 pulses, and then we just repeat that 3 to 5 times a week for 30 treatments. So it's really the cumulative effect of TMS kind of builds the symptom relief over time, but a lot of people notice benefits sometimes even in the middle of the first treatment or within the first 5 treatments. Anything from sleep regulation improvement or energy, focus, anxiety relief, and mood improvement.
Well, I can't wait for that. It just feels like, it literally just feels like somebody tapping on my head.
Yeah. A lot of our patients endearingly call it the woodpecker, but sometimes it's not even that strong of a tapping sensation.
No. Kind of an interesting experience. There was no pain involved. It just felt like a little tap on my head. If folks are starting to feel like something's a little off, it's probably best just to call Gulf Coast Neurospa. They have a location in Ocean Springs and in Gulfport. Give them a call and they will try to get you on the right path.
Certainly. And thanks for coming and learning about TMS today.
For sure. Thank you, Stephanie. Thanks so much.